From the past, maintaining youth has been the lasting hope of all mankind. Recently, development of science and medical procedures diversify the methods for preserving youth. In plastic surgery, anti-aging is the representative. Anti-aging is a complex surgery of the highest dimension. Doctor must master anatomy, obtain deep knowledge in aging process, and must acquire various surgical methods. Also, the doctor must introduce proper method of using peeling, laser, massage, cosmetics, and recommend other methods that can postpone aging process. Aging process doesn't come partially, therefore entire face must be considered after middle age. Since it's the surgery on entire face rather than parts, anti-aging requires vast knowledge and experiences. However, ineffective anti-aging surgical methods are being performed. Simple manipulation and surgeries based on shallow knowledge, such as facelift using threads, usage of implants and Botox, either fails to be effective or have damaging side effects. Aone Plastic and Aesthetic Surgery holds annual symposium and has accumulated abundant knowledge and experiences through continuous research by cadaver dissection. Not only that, it stays true to the principle, and based on the patient-centered philosophy in a pleasant environment, it has been performing countless anti-aging surgeries, as well as treating patients that had failed to see effectiveness or had been damaged through shallow surgery. Anti-aging is referred to as flower of plastic surgery, and it has various surgical methods. From now on, we will listen to Dr. Kwon's detailed explanation on forehead-brow lift.
중년 이후에는
Today, I will
노화
tell you
현상으로
about forehead-brow lift. After middle age, eyebrows sag down from the aging phenomenon. At this time, eye surgery will make the person's image too fierce, so just having eye surgery must be avoided. Also, even for a young person, if eyebrows are genetically sagging down, then double eyelid surgery must not be done. The reason is because it's not the eyelids that are sagging, but the drooping of forehead and eyebrows that make the eyelids appear sagged. As I mentioned above, whether it's for young people or those past middle age, just having eye surgery in the case of sagging eyebrows will make the person's image too strong. I will tell you about the principle of forehead-brow lift. Unlike the common misconception, forehead-brow lift is not the surgery which physically pulls eyebrows upwards. Principle of this surgery is raising the eyebrows by cutting the muscles that pull down the eyelids, as well as glabellar muscles, in order to weaken the pulling down force and make the lifting force of frontalis muscle relatively stronger. Therefore, this surgery is not about forcefully lifting up the eyebrows, but about creating natural appearance by physiologically lifting up the eyebrows. The muscle marked red in this picture is frontalis muscle, which pulls the eyebrow upwards. This muscle is big in size, but there's only one of it. Compared to frontalis muscle, there are 5 small muscles that pull down the eyebrows. The fact that there are so many of them allows us to display elaborate expressions around the eyes. The muscles marked by red circles are responsible for frowning on glabellar region. In other words, they are the muscles that form glabellar wrinkles. If these muscles are developed or overused, then glabellar wrinkles form and inner eyebrows sag further. Forehead-brow lift is performed using an endoscope. Left photo is endoscope machine, and in the right photo are the equipments used for dissecting skin or cutting the muscles. Like the photo shown here, surgery takes place by watching the endoscopic view. Since endoscope is used, incision length on the skin is very short. About 1 centimeter incision is made on 3 places, and point of incision is at where forehead skin and scalp meet. This photo shows sutured skin after surgery. Generally, stitches are removed after 7 days, and once they are removed, incision sites become nearly invisible. Here's an endoscopic view under the glabellar region. Red arrows indicate glabellar muscles. This muscle causes glabellar wrinkles to form and pulls down the eyebrows. These glabellar muscles must be cut off in order to prevent glabellar wrinkles from forming like shown in the photos here. Top photo is prior to cutting off the muscles. In other words, it's the view before surgery. Whereas frowning formed deep and numerous wrinkles before surgery, after surgery, like the bottom photo, wrinkles appear only slightly when the person is frowning hard. Eyebrows are lifted up by cutting the glabellar muscles and muscles that pull down the eyebrows. And the final procedure is fixating the forehead skin on the bone in order to position the eyebrows on desired position. In our hospital, we create a tunnel on the frontal bone and fixate the skin here. Endotyne was used in the past, but it was expensive and patients complained of long-lasting severe headaches. Despite all that, it wasn't more effective than any other methods. Therefore, recently Endotyne is not used, and instead skin is fixated on the tunnel made on the frontal bone. Ultimately, fixation method isn't the most important thing, and the integral procedure of this surgery is proper handling of the muscles that pull down the eyebrows and glabellar muscles. Forehead brow lift varies according to the form of sagging eyebrows. Surgical method is differentiated according to whether the entire eyebrows are sagging or inner eyebrows are sagging more than the outer eyebrows and vice versa. The patients shown here had eyebrows that were sagging overall. At this time, eyebrows can lift up by cutting or weakening the force of the glabellar muscles, the muscles that pull down the eyebrows, and the muscle on the outer area marked here with an orange circle. Looking at the surgical result, we can see the eyebrows were lifted up overall and her appearance became much more gentle. Here is 45-degree angle view. And here is 45-degree angle view from the other side. This patient had sagging inner eyebrows. In this case, glabellar muscles must be handled well. In order to raise the inner eyebrows, the muscles underlined red in this photo must be well handled. I've mentioned before that these muscles form glabellar wrinkles by forming expressions on glabellar region. In case of sagging inner eyebrows, these muscles must be well treated in order to lift the inner eyebrows. Here is 45-degree angle view before and after surgery. One can observe changed inclination of the eyebrows. The photos show that especially inner eyebrows have lifted up relatively more than the outer eyebrows. Smiling appearance looks natural. Unlike the aforementioned patient, this patient has sagging outer eyebrows. In this case, muscles positioned on the outer regions must be well treated in order to raise the eyebrows. Like shown in this photo, the muscle located on the outer area must be well handled to properly raise the outer eyebrow. Especially from 45-degree angle view, one can identify that outer eyebrows lifted up. Thanks to raised outer eyebrows, hidden double eyelids are exposed. Even for a young woman, if eyebrows are sagging genetically, eye surgery must be avoided. Sagged eyebrows made this patient's eyelids appear sagged as well. Despite her strong eye image, just having eye surgery will make her appearance even more fierce. Sagging eyebrows made the eyelids sag as well, and sagging eyelids are covering the eyes. Some doctors have the tendency of diagnosing this kind of eyes as ptosis. However, this is not ptosis in which eyelids cannot lift up completely, and instead is the case of sagging eyebrows. Sagging eyebrows make the inner area of the eyes as having an epicanthic fold, but this is actually not the case. Some doctors even remove this region, claiming that it's epicanthic fold, but removing this will expose too much red flesh, thus making the person's image too strong and the eyes appear dull. Although I suggested forehead brow lift to this patient, she decided to have the eye surgery. Here's the view after eye surgery. Double eyelid lines do not show. Distance between the eyes and eyebrows shortened, and her image became much more strong after surgery than before. Ultimately, forehead brow lift can improve the image. This photo shows that her image became gentle, and especially the epicanthic fold disappeared after forehead brow lift. This is because eyebrows were lifted up. Likewise, even for a young woman, eye surgery must not be done in the case of sagging eyebrows, and instead forehead brow lift must be performed. If the patient really wants eye surgery, then it must be performed simultaneously with forehead brow lift, and just having the eye surgery must be avoided. As I've mentioned many times, just having eye surgery will make the person's image too strong. This patient had sagging eyebrows. Not only that, she didn't have double eyelids and she lacked fat on her eyelids. This patient had forehead brow lift, double eyelid surgery, and upper lid fat injection at the same time. Here's the profile view. And here's the view from 45-degree angle. In order to create a cuter image, pretarsal roll was made under the eyes using fat injection. In this patient's case, although she is a young female, sagged inner eyelids made her image strong. For this patient, forehead brow lift was performed, which lifted inner eyebrows more than the outer eyebrows. Simultaneously, she had nasal tip surgery and fat injection on forehead and chin. Here's the view from 45-degree angle. Like the photo shown here, actual height of the eyebrows didn't change too much, but the outcome shows significantly changed image. Up until now, I have shown you the principle and surgical method of forehead brow lift and the results of patients who had the surgery. Special caring isn't necessary after forehead brow lift. Generally, stitch out is after 7 days. Also, at first, some patients worry that their eyebrows were lifted up too much, but usually eyebrows move down after a while, and ultimately they lift up about 5 to 6 millimeters. Lifting it up more than that could make the person's image appear surprised or irritable. Like other surgeries, forehead brow lift has the possibility of side effects. However, from my experience, most of them are temporary symptoms. For about 3 months, there could be decreased sensation on forehead scalp, and also during the recovery process, scalp could feel itchy. There is a possible danger of facial nerve damage, but if the operating doctor has sufficient knowledge on anatomy, it can be avoided. In addition, undercorrection in which eyebrows lift up less than expected, and scarring or infection on the surgical site are the possible side effects common in all surgeries. In the case of sagging eyebrows, instead of performing forehead brow lift, occasionally skin above the eyebrow is removed to raise the eyebrow. This method is not used in normal situations. This kind of surgery is performed for aged patients with severely sagging eyebrows or for patients that have severely sagging eyebrow on one side from facial paralysis nerves formed after an accident. The patient in top photo had severely sagging right eyebrow from an accident. So, skin above the eyebrow was removed, like the bottom photo, in order to adjust his eyebrows into symmetry. However, if a normal patient had this kind of surgery, there could be disadvantages such as too much scars and a mean appearance from excessively lifted up outer eyebrows. In some recent cases, skin under the eyebrow is excised. And in my opinion, this is the worst method. Removing the skin under the eyebrow when sagging eyebrows is the cause will make the eyebrows sag even more, like the photo shown here. Not only that, it leaves excessive scar. However, eyelids barely lift up. Until now, I told you about forehead brow lift. Integral part of forehead brow lift is cutting off the glabellar muscle and muscles that pull down the eyebrows. Also, for patients past middle age with sagging eyebrows and even for young people with genetically sagging eyebrows, eye surgery must not be performed. And if the patients with sagging eyebrows want to change the image of the eyes, then forehead brow lift and eye surgery must be performed simultaneously. Please remember this. Thank you.